I'm George Williams with the American Academy of Ophthalmology. Like many of our colleagues, I have significant concerns about the federal government's complex and sometimes punitive rules on physician reimbursement. That's why I'm speaking to you, my fellow Academy members and colleagues, about the early dividends that the Academy has seen from our months-long campaign for regulatory relief. We've worked to protect ophthalmologists from significant quality program penalties that will impact your payment in 2018. These penalties result from the Physician Quality Reporting System, or PQRS, and the value-based modifier. These penalties can add up to 10% and clearly jeopardize our profession's ability to provide quality eye care where needed. This campaign is a major priority for our physician leaders and Washington, D.C. staff. Right now, the Centers for Medicare and Medicaid Services is responding favorably to our advocacy. In its 2018 draft fee schedule rule for Medicare physicians, CMS is proposing significant reductions to the penalties associated with these exceedingly burdensome programs. For example, CMS proposes to cut in half the penalties related to the value-based modifier. CMS also wants to reduce the number of measures on which you're scored in PQRS. This change will help more ophthalmologists succeed and avoid a penalty next year. These changes arrive at a critical moment. CMS is imposing penalties on approximately 40% of all ophthalmologists this year. Next year, the size of the penalties will increase. If we can reduce these penalties by even 2 to 4%, it will make a difference. Each percentage point represents a nearly $7,000 reduction. That's money that helps you grow practice, pay your staff, or operate an office in an underserved community. To move the needle on this issue, the Academy is playing a principal role across all of medicine. We're leading a wide-ranging coalition of medical specialty organizations. While previously we'd never had a meeting with the Secretary of Health and Human Services, we've already met twice with Secretary Tom Price, and many members of Congress are speaking out on our behalf. There's more work to be done. We need CMS to ratify these proposed changes. We need some fixes to go further, like more credit for participants in the Academy's IRIS registry. I wanted you to know that your Academy is working on your behalf to protect your profession and your patients. Thank you for your support. I look forward to sharing more good news in the future.